Hello, dear friends. It's good to be with you again today, and we will start another series. Last time we took a series on hypertension in pregnancy, which is elevated blood pressure in pregnancy, and this time we're going to take another medical condition in pregnancy. And we're going to take a common medical condition in pregnancy known as diabetes in pregnancy. Now, for today's episode, I'm just going to focus on generalistic perspectives of diabetes in pregnancy, and subsequently, I'm going to split it into trimester after trimester, then take a detailed outlook of what a pregnant woman should do, or a pregnant woman who is diabetic, and the things that she needs to do to manage the diabetes, or those who are not diabetic, what they need to do to prevent diabetes. So that's what we are going to do for the next series of sessions we are going to be having. Firstly, let me just debunk some myths. Diabetes is not caused by taking excess sugar. I know that a lot of people feel, oh, when you're pregnant and you take excess sugar, you're going to have diabetes. That's not true. And that is not also true for the non-pregnant states. So people go around with this perspective that when you take things that has a lot of sugar, you're going to come down with diabetes. That's not true. So diabetes is not caused by excess sugar. Diabetes is actually seen by many experts as a form of, could be an autoimmune disease, but most of the causes of diabetes are linked to familial tendencies. For instance, if you have monozygotic twins, that's what you may refer to as identical twins, twins who have 100% of their genes that are common. They have a 100% concordance rate for diabetes. What does that mean? That means that if one twin has diabetes, there's a 100% risk that the other twin is going to have diabetes at some point in that person's life. It may not happen simultaneously, but will happen subsequently. That's to show you that there are genetic factors that are predisposed to diabetes, so it tends to be familiar. Then for first degree relatives, when we first degree relatives, talking about your sibs or your parents, if one of them have diabetes, you have a 50% chance of developing diabetes. So that is how it goes. Then when you talk about second order relative, the risk of diabetes is similar to general population. At that point in time, it cancels out. So those are the risk factors. Risk factors are mainly familiar, and there are many things that could decrease these risk factors. One of the things I want to say that those who are diabetic already need to be careful with the quantity of sugar they're taking, because the patients who are diabetic find it difficult to handle sugar. So that's the caution I need to throw in quickly. So diabetes is not caused by taking excess sugar, but when you become diabetic, you need to be worried about the quantity of purified sugar that you consume. And this is so for even a pregnant woman. I'm going to stop at this point, then I will take more next week. Bye.